How to get pregnant without having sex. Generally, people opt for sexual intercourse without any protection when they are looking to conceive a child. However, the possibility still remains that the traditional method of conception may not work. Fertility-related medical conditions can make getting pregnant through intercourse difficult, apart from which several situations may require a different approach to conceiving. Being a single woman or a partner in a same-sex relationship should not deprive anyone of the joys of parenthood. There are a number of ways a woman can get pregnant even without having sexual intercourse. Given that the traditional method of natural conception is not one that is working or one that can be employed, there are enough options to consider to realize your dreams of becoming a parent. Medical advancements have now made it possible to not only conceive but carry a healthy baby full-term, without intercourse. Methods of getting pregnant without intercourse. Some of the methods mentioned below can help you have your baby by becoming pregnant in a different way. 1. In vitro fertilization. In a few cases, the woman might be healthy enough to carry the baby to term, but fertilization itself might be an issue. This is where IVF plays a vital role. IVF is available in numerous infertility clinics across the country, and the process is quite straightforward. Medication is administered to boost the egg production of the woman, which is then extracted. The eggs are then placed in conditions where they can be fertilized with the sperm of the woman's choice. Once an embryo is successfully formed after fertilization, a catheter is used to open the uterus and place the embryos inside. Some women tend to feel a little pain and cramping in their abdomen as the embryos attempt to get implanted inside the uterus. This is a great way to get pregnant, but the process can get expensive. 2. Opting for the turkey baster technique. Very few people might be aware of this technique, while numerous others might think of this as a quick and easy method. Mostly adopted by couples of the same gender, this can be compared to artificial insemination. And no, you don't use an actual turkey baster for this technique. The steps are rather simple. Sperm needs to be procured either from a known person or the sperm bank. An insemination syringe is then used to collect the sperm, which is then inserted inside the vagina of the woman, letting the sperms inseminate within. This is rather painless, and there is no recovery time as such since this isn't a medical procedure. Having the pelvic portion tilted upwards for some minutes to stop the sperm from spilling outside is recommended. Bear in mind that when attempting at-home insemination, there are some very important points to know. Before you go through with it, speak with your doctor to understand safety precautions that you must adhere to, do's and don'ts, as well as your chances of conception through this method. Track your period and ensure the dates that you are working with are in your fertile period, close to your date of ovulation. Do not attempt to insert the sperm into the uterus or cervix, as this can be extremely dangerous. Sperm should be inserted only into the vagina. Use a new, clean, needleless disposable syringe to insert the sperm into the vagina. Collect the semen in a clean, dry receptacle, then pull into the syringe. Make sure that there is no air in the syringe, as the introduction of an air bubble may cause an embolism which can be fatal. Remember that this method of insemination does not protect you from sexually transmitted diseases. 3. Insemination within the uterus. This is a slightly advanced medical technique, termed IUI, which is a combination of the turkey baster technique and IVF. This is usually opted for by couples where the male partner's fertility levels are lower, or by single women who are fit to have a baby. During ovulation, the egg reaches the uterus, awaiting fertilization by a sperm. In IUI, the woman chooses the sperm either from a donor or the bank. A medical professional then introduces the sperm right inside the uterus close to the egg using a catheter. The process is similar to that of a pap smear test. Lying down by tilting the pelvis upwards can help increase the chances of fertilization. Most women feel only minor cramps, and they can resume their usual lives within no time. However, this process might have to be repeated for a bunch of cycles until it is successful. 4. Splash pregnancy. At times, a couple may fail to have proper sexual intercourse because of conditions like erectile dysfunction or vaginismus, faced by a man and woman respectively. This makes it either difficult to have intercourse or painful. However, there is still a way for the couple to try and get pregnant. Many young adults are advised to use protection because even the slightest exposure of sperm to the vagina can cause a woman to get pregnant. This is exactly what a couple can try and use to their advantage, by trying to have an ejaculation as close to the vagina as possible. Some women can bear penetration up to a certain depth. This is even better since the ejaculation can take place inside the vagina and the woman can tilt her pelvis upwards to increase chances of conception. Success using this method is at random, but you can always choose to do this before opting for any other methods. 5. Having a surrogate carry the baby. In some couples, one or both partners may be infertile, or the woman might not have a uterus strong enough to hold the baby. But couples tend to want a baby of their own. This can be achieved via surrogacy. The sperm of the male and the eggs of the female are combined in a laboratory environment to allow fertilization and the formation of an embryo. This embryo is then placed in the womb of a willing surrogate, who will carry the baby for the duration of the pregnancy, and then hand it over to the original parents. Surrogacy, of course, is an expensive option with fees and other expenses to be taken into account. Now, it certainly is up for debate whether you would technically be pregnant if you have a surrogate carrying your baby. But no doubt, you will most certainly have a baby that will be your very own in every way. There are numerous ways to get pregnant without penetration, and each one has its benefits and costs associated with it. Intercourse might not be a choice or a possibility in a few cases, and this is where medical science can come to your rescue. However, if none of these methods seem to work, it is best to keep yourself open for adoption as well, since that can provide you with the joy of being a parent, too.